At the end of the lecture, the students will be able to explain immediate signs of death with special stress on somatic or clinical death, define suspended animation, summarize postmortem changes in the eyes, describe early changes after death such as Mortis, that is cooling of the body, physiochemical changes in various body tissues and organs under various environmental conditions such as changes in the muscular system after death. Now, first of all, what, why we should know about changes which occur in the body after death. Changes occurring in the body after death, these help us to, the study of these changes is important because it helps us in establishment of the moment of death, then recovery of viable tissues from the donor's body, third day pronouncement, certification and disposal of the dead, and fourthly, estimation of time elapsed since death, that is, we call it as postmortem interval. Now, the changes which occur with death, subsequently, these changes are physical as well as chemical. Now, physical changes are those which are occurring in the body, systems, and tissues which are appreciable by visual examination, and you can see them with your eyes. Then, chemical, occurring in the chemical constituents of the body tissues and fluids observed by biochemical and histochemical examination. Now, these changes have definite relationship with time. So, study of these changes help to estimate time since death. Now, with the relationship to the time, the physical changes are divided into three categories. Immediate, which occur in moment to minutes, then early, which occur in minutes to hours, and late, which take days to months. Now, immediate changes, they are concurrent with clinical death, that is somatic death. That is loss of innervation, that is the nervous system is gone, cessation of circulation, cessation of respiration. Beside these, pallor of skin, muscular flaccidity, the muscle that become flaccid, changes in the eye. Now, then we have early changes which are concurrent with the molecular death. Molecular death means death of the individual cells and tissues of the body. These are Mortis, that is cooling of the body. Mortis is also known as death stiffening, that is stiffening of the body after death. And Mortis, that is discoloration of the body after death. Then we have late changes which are putrefaction. Now in putrefaction, there is the body is converted from organic into inorganic state by the action of bacteria. Then we have mummification, we have adipocere formation. Now, first of all, coming to immediate signs. Now they say although these signs are considered to be sufficient to cause death, but as you know, there's a condition known as suspended animation, also known as apparent death, where the heart, lungs, and brain function at such a low level that the apparently person appears dead. Now, this apparent death may be voluntary or involuntary. Voluntary in cases of hypnotic trance, yoga, or involuntary in cases of epilepsy, hysteria, cholera, typhoid, sunstroke, concussion, drowning, electric shock, tetanus, and anesthesia. And these stages can be revived by cardiac massage or electrical stimulator along with artificial respiration and thus save a person from premature burial. Now, they say ordinary life is not compatible if heart has ceased functioning for more than 3 to 5 minutes. Now, permanent and complete loss of power to move. This can be confirmed by EEG pattern, where EEG, that is electroencephalogram pattern, where we get a flat graph provided facilities for EEG are available. Then permanent cessation of circulation, permanent cessation of respiration, or in other words, permanent cessation of tripod of life. The life is standing on 3 pillars, that is the brain, the heart, and the lungs. And all of these 3, they stop functioning permanently. Then this is death. Now, test to demonstrate stoppage of circulation. First test which we perform is Magnus Test. Now this test is most reliable and is performed by tying a ligature tightly around the base of a finger. Now it should be tight enough to occlude the venous flow without occluding the arteries. Now if the finger remains white, this means that the circulation has ceased entirely because you have occluded the veins, but you have not occluded the arteries. Otherwise, the site of ligature is marked by a colorless zone and the portion beyond it gradually becomes blue and swollen because arterial supply is there, but the venous blood cannot go back, so gradually the finger becomes blue and swollen. This indicates that the person's circulation is intact. Then second is diaphanous test. If hand with fingers abducted is held against strong light, now during life, the webs between the fingers appear scarlet red and translucent, while they appear yellow and opaque after death. But in some cases, the hand may appear red in carbon monoxide even during life and may appear yellow even in cases of severe anemia. Then third is Ecart test. Now this test is performed by hypodermally injecting solution of fluorescein. Now this solution of fluorescein contains resorcine naphthalene. Now this is injected hypodermally. Now if circulation has ceased, there will be no discoloration of the skin around the site of injection. But if circulation is present, it renders the neighboring skin yellowish green. Now moreover, this substance can be also detected in the blood drawn by pricking the skin at some distance from the site of injection. Now, if some white silk threads are immersed in blood and then boiled in a test tube containing distilled water, the threads become greenish in color because of the resource in naphthalene. But if there is no circulation, the threads will remain white. Then fingernail test. Now, during life, when we apply pressure, the nails become pale. And when we withdraw the pressure, the nails become pink. That is, it does not alternate on application and withdrawal of pressure to the fingernail. It does not assume alternately white and pink color as seen during life. Then heat test. On application of heat with burning matchstick or melted sealing wax to the skin will not produce a true blister with red line of demarcation. If circulation has stopped, that is, there will be no vital reaction seen, there will be no redness, etc. Then blood flow test. If a small artery is cut, if circulation has stopped, there will be no jerky flow of blood because there is no pressure in the vessels. Then there are some tests used to determine permanent cessation of respiration. One of them is known as Vinslow Stretch. Now, if we take a cup or a saucer full of mercury or water and place it on the chest or abdomen of the person as normal breathing is thoraco-abdominal, and then we focus artificial light or sunlight on the surface of this, and an image will be formed. It is reflected on the opposite wall. If we closely observe that image, if it moves up and down, this means that the person is breathing. But if there is no movement of the image, this means that the person's respiration has stopped. Then second is mirror test. Now surface of a cold, bright-looking glass held in front of open mouth and nostrils become dim due to condensation of warm, moist air expired from the lungs if respiration is still going on, but no change if respiration has ceased. This test is useful in cold weather. Then feather test. There will be no movement of a feather or a cotton fiber held in front of mouth or nostril if respiration has ceased. This is not reliable as slight draught of air or nervousness, that is tremors, can on the part of the observer will move the feather or the cotton fiber, or suppose if the ceiling fan is on or the window is open. So the draught of air which will come, it will move the fibers, and you may get a wrong interpretation that the person is breathing. Now, what are the changes in the eye? The eyes stare vacantly, lose their luster. Pupils assume mid-position and dilated. Corneal reflex is lost. Cloudiness of the cornea occurs. Cornea becomes dry and hazy. Intraocular pressure falls to zero in 4 to 8 hours. During life, the normal pressure is 10 to 22 millimeters of mercury. Now the eyeball becomes flaccid and sinks into the orbits. Now the sclera, that is the white portion of the eye, show triangular areas of brownish or blackish discoloration if eyes remain open after death for 3 to 4 hours due to formation of cellular deposit, debris and dust deposition settling therein. This is known as tachynoir. Now the color changes from yellow to brown to black. So you can have an idea that at times in death is 3 to 4 hours if the eyes remain open after death. Now this is a picture of tachynoir. You see brownish black discoloration. This is another picture of tachynoir. You see the brownish black color of the sclera. Now, most important are the retinal changes. Now, these are studied by using ophthalmoscope. Now, within minutes, segmentation of the blood in the retinal vessels shows segmentation. This is known as cattle trucking. This disappears after 1 hour. Now, this cattle trucking in new books, it has been mentioned as Kevorkian sign. Now, within first 3 hours, area around the optic disc becomes yellowish. Choroidal vascular pattern, clear red background. In the next 3 hours, that is total 6 hours after death, choroidal vascular pattern becomes pale, homogeneous. Then in 6 to 12 hours, optic disc outline starts fading. After 12 hours, all traces of disc and retinal vessels disappear. Now, changes in the ocular fluids. Aqueous fluid is present in the anterior and posterior chambers. Vitreous fluid is present in the body of the eyeball. Now, we take the sample of this ocular fluid. Now, The method is that the latest canthus of the eye is drawn more laterally, and then we use a 20-bore needle by gentle inserting downwards and toward the medial direction, and then gradually sucking about 2 ml of fluid from each eye. Now, after suction, what we do is we inject same amount of water in the eyes so as to restore the contour of the eye. Observations of this fluid which we have taken. There is a steady rise of potassium concentration of vitreous fluid. There is linear arithmetic relationship between potassium concentration and post-mortem interval for over 100 hours after death. As the time will increase up to 100 hours, the potassium will also increase. Then coming to Rigor Mortis, that is known as cooling of the body. Now, how will you define it? With death, the body after a short interval loses heat, which it possessed at the moment of death. Now, in our country, the usual rate of cooling is 0.5 to 0.7 degrees centigrade per hour, and body attains the environmental temperature in about 16 to 20 hours after death. Now, what is the physiology during life? Heat loss by all routes from a wasting and unclothed body is equal to heat production at the individual lowest metabolic rate. So, during life, heat production is equal to heat loss. Now, departure from normality in either direction will lead to vital response, maintaining the body temperature as a whole. Now, in death, this vital response is not possible, so the body loses heat. Now, what is the mechanism of heat loss? Dead body cools by the process of radiation, conduction, and convection. Here we come across Newton's law. Now, Newton's law says that the rate of loss of heat at any time is directly proportional to the temperature difference between the surface of the object and its surrounding. If the surroundings are hot, the body will lose heat more rapidly. If they are cold, the body will lose heat more slowly. If there's a wind, it will lose heat more rapidly. Now, what are the problems in estimating time since death in human body? The human body is composed of all physical states of matter, that is, solid, semi-solid, fluid, gases, so that the loss is not uniform at all surfaces. Body surface, that is outer core, cools rapidly than the center, that is the inner core. Now, how will we record the temperature of the dead body? Now, the idea is to record the inner core temperature. And the instrument which we use is the chemical thermometer known as Thanatometer. It is 25 centimeters long and is graduated from 0 to 50 degrees centigrade. Now, nowadays, electronic thermoelectric probe or couples are available, which are inserted into the nose or into the ear, and temperature is recorded. Now, the sites used are for recording temperature by this thanatometer are rectum, vagina, subhepatic region, and for these electronic devices, that is such as thermoelectric couple, nasal cavity, auditory meatus are there. A procedure for rectal and vaginal temperature. Insert the thanatometer, this thermometer which is known as thanatometer, for 4 inches, that is up to 10 centimeters, deep to the external orifice and keep it in position for at least 3 minutes and record the temperature. But the limitation is that these routes cannot be used in cases of sexual assaults. So what you will do in that case? In those cases, we will go for subhepatic route. What we do is we make a slit in the right hypochondrium, 4 inches deep, insert the thermometer into the slit and keep it there for 3 minutes and record the temperature. Then for nasal and auditory route, thermoelectric couple is used. Note, now the most important thing which we don't do here is in all the cases the environmental temperature is also noted. What are the factors which influence the results? What is the temperature at the time of death? Accuracy is presumptive. Then temperature may be subnormal in deaths due to massive hemorrhage, exposure to cold, alcohol, barbiturates, and opium intoxication. And at some time, there is hyperthermia is noticed in deaths due to bacterial infection. Because of bacterial activity, heat is produced. In cases of pontine hemorrhage, heat stroke, atropine poisoning, strychnine poisoning. In strychnine poisoning, there are violent contractions of the body, and because of these contractions, the heat is produced from the muscle. Now, this rise of body temperature after death for first 2 hours is known as postpartum caloricity, and after 2 hours, then the body cools as usual. Secondly, clothings. Now the clothing, they retard heat loss. Then body surface area. Now the rate of cooling depends upon the mass, that is surface area ratio, mass and surface area ratio. Thin person and infants have relatively large surface area. Therefore, they cool rapidly. Body physique, fat person retains heat due to subcutaneous layer of fat acting as a heat insulator. Then person with edema, heart failure, that is heart failure, kidney failure, will retain heat due to high specific heat of water. Then environmental conditions such as cold, heat, wind, droughts, rain, and humidity alter the rate of heat loss. Then artificial factors, for example, hot water bottles, radiated heat from room heaters, air conditioners, etc. They all will affect the rate of cooling. Now we come to the most important change, early change after death, that is rigor mortis or postmortem rigidity. Now, rigor mortis is a Latin word meaning stiffening after death. Definition of rigor mortis: it is the stiffening of the body due to physicochemical phenomena involving muscle fibers after death. Now, this is a picture showing rigor mortis. Now, after death, the muscles of the body, they pass through 3 stages. First of all the muscles of the body relax. That stage is known as primary relaxation. And then after some time, rigor mortis sets in. All the muscles, they contract. Then thirdly, as putrefaction sets in, the rigor mortis passes off, and then the muscles relax again. Now this relaxation is known as secondary relaxation. You must have seen when the person dies, usually they close the eyelid, they straighten the arms, by the sides of the body. They tie the big toes of the both feet together so that the body should be in a presentable position for burial. Now, what is the mechanism or physiology of rigor mortis? Now, each muscle fiber is composed of myofibrils, that are the contractile elements, which are made up of two types of protein named myosin, which is thick, and actin, which is thin. Myosin and actin are arranged in interdigitating manner. Now, in relaxation, interdigitating manner is of a limited extent. Now, during contraction, what happens? Actin is drawn into myosin. Now, this power of contraction and relaxation is dependent upon presence of an enzyme known as adenosine triphosphate. In short, we call it ATP. You see in this picture, the thick ones, these are the reddish ones, these are the myosins, filaments, and these greens are actin filaments. Now this is relaxed muscle. Now during contraction, these actin is drawn into myosin and the contraction occurs. But this occurs only in presence of ATP. After that, this ATP rapidly disappears. So what happens? This actin and myosin filaments, which are arranged in interdigitating manner, they fuse together to form a stiff, dehydrated gel, and we say rigor mortis is established. Now, there are two theories of rigor mortis. Theory number one is after death, actin and myosin become stiff and get converted into a rigid gel. Reason: adenosine triphosphate of the cell decomposes. Second theory is that due to permanent oxygen lack after death, lactic acid and other tissue metabolites accumulate in the myofibrils. The protoplasm, which is liquid in life, becomes sufficiently acidic, thus becoming a gel, adhering the myofibril together and making the muscles rigid. Now, as far as onset and duration of rigor mortis is concerned, it is said that the rigor mortis always follows proximo-distal course from above downwards. Now, this is known as Neston's law. Now, there are three phases of rigor mortis. Developmental phase, clinically manifested in 2 to 4 hours after death, and this is fully developed from top to toes in 9 to 12 hours. So this is the developmental phase. Then we have the static phase, that this rigor mortis will persist in whole of the body for 12 hours. Then after persisting in the body for 12 hours, we will have the third stage, that is passing off or resolving phase. That is, it will pass off in 12 hours. So it will take 12 hours to develop. 12 hours it will stay in the body and pass off in another 12 hours. Now they say there's a rule known as rule of 12, rule of thumb, that each stage stays for 12 hours. But in our country, rule of thumb is that each stage lasts for 4 to 6 hours in summer and 10 to 12 hours in winter season. Rigor mortis involves involuntary as well as voluntary muscles in a particular sequence. Now, it must be remembered that in the heart, it appears within an hour after death. Now, why you should know this? Because when rigor mortis will set in the heart the walls of the heart will contract and they may appear thickened. Now this heart may be confused with this thickening maybe of the walls, may be confused with hypertrophy of the heart, which is a pathological condition. Now, in voluntary muscles, rigor mortis appears in a particular sequence. First, the muscles of the eyelids. Why first the muscles of the eyelids? Have you ever thought how many times we blink in a minute? Now these muscles of the eyelid, they are thin and their amount of ATP is very short. So after death, it is depleted very rapidly. So muscles of the eyelids are affected first, then muscles of the face, then muscles of the lower jaw, then muscles of the neck, then muscles of the chest, then muscles of the upper extremities, then muscles of the trunk, then muscles of the lower extremities, and last to be affected are small muscles of the fingers and toes. How will you check rigor mortis? It is checked by attempting to lift the eyelids, by depressing the jaw, or gently bend the neck by placing a hand behind the neck on the occiput. We try to flex the neck and we try to bend various joints of the body and we will meet resistance. This means rigor mortis has developed. Now, development versus duration. What are the factors? Early onset and short duration. In which conditions? When there is a lot of muscular exertion before death. In cases of convulsant poison such as strychnine, or in cases of violent deaths, there was a lot of struggle before death. So after death, the ATP will rapidly disappear and rigor mortis will appear early and its duration will be short. Now, delayed onset and longer duration. Deaths which occur due to hypothermia, which occur in cold, and secondly, in cases of sudden death, because the person was not exerting in cases of sudden death. Then factors influencing the rigidity. Number one is the temperature of the body and environment. Disappears early in extremely hot environments. Fulminating bacterial infection. In such conditions also, because the body temperature is high, it will disappear, where it will come on early and it will disappear rapidly. Then condition prior to death, convulsions, muscular activity, hasten the development of rigor mortis. Now, general physique. In cases of poorly or incompletely developed it is poorly or incompletely developed in elderly, very young and severely debilitated persons. Fully and well developed in healthy adult dead bodies. Its development, it develops in paralyzed muscles also, but is feeble. Now there are certain conditions which simulate rigor mortis, means you can confuse those conditions with rigor mortis. Number one is heat stiffening, which is stiffening due to exposure to intensive heat, such cases of burns. Now, mechanism is that because of excessive heat, what happens? There is coagulation of the albuminous material of the muscles, so rigor mortis will not appear. And second is cold stiffening, due to exposure of the body to extreme cold. Here what happens? body fluids are frozen and solidification of subcutaneous fat and muscles occur. How will you differentiate between cold stiffening and rigor mortis? Remove the body to warm atmosphere. After some time, the fat will liquefy, the body will liquefy, and then normal rigor mortis will appear, but it will persist for a short time. Now, the third condition which simulates rigor mortis is known as gas stiffening. This is also known as false rigidity or pseudo rigidity. It is not stiffening involving the muscle fibers, but it is seen in those conditions where the body has started decomposing, that is putrefying. It is due to accumulation of gases of putrefaction into the tissue spaces, giving an impression of rigidity. So this is known as false or gas stiffening. Now the fourth and most important condition which resembles rigor mortis is known as cadaveric spasm, or also known as instantaneous rigor. Now, cadaveric spasm is a condition in which is restricted to a single group of voluntary muscles. Sometimes the whole body may undergo it, but usually it is restricted to a single group of voluntary muscles. Now here, the last voluntary contraction during life continues after death without passing through initial period of primary relaxation. So the contraction is therefore instantaneous, it's continuous after death. For example, you see if a person in his full senses falls in water, he will struggle. He will try to catch hold of anything to save himself. Now in this picture you see there are grass weeds grasped in the hand. Now this indicates that the person was in his senses when he fell in water and he struggled for survivorship. So we get two things from this, that the person was alive as well as he was conscious and he struggled for survivorship. So this is known as cadaveric spasm. That is the last voluntary contraction during life, continues after death without passing through initial period of primary relaxation. Now, what is the medico-legal importance of cadaveric spasm? It records the last act of life, so can help us in determining the cause and circumstances leading to death. For example, if a person intends to commit suicide by cutting his throat or by shooting himself, now here the last way, because he was under great emotional tension, the weapon will be found firmly grasped in his hand. The weapon such as pistol or the sharp-edged weapon used for cutting the knife will be firmly found grasped in the hand. So you can have an idea about the cause and circumstances leading to death. Then, during struggle for survivorship, suppose two people they are fighting. One may catch hold of the other. Some portion of the clothing may be firmly grasped in the hand. For example, pocket of the accused shirt may be firmly grasped in the hand of the dead body, and from there you can have a lot of help in detection of crime and the criminal. Now, what is the main difference between cadaveric spasm and rigor mortis? Now, comparable features, both conditions point to muscular rigidity. Now, first of all, coming to indicator, time of occurrence, cadaveric spasm, that is the last moment of life, that is the last voluntary contraction during life, continues after death without passing through primary relaxation. Rygemort is first there's the stage of primary relaxation, and then rigor mortis will occur. So hours after death. Then phase of primary relaxation. This is absent in cadaveric spasm, but it is present in rigor mortis. Then occurrence. In few cases, this cadaveric spasm occurs with some predisposing factors, great emotional excitement, mental tension, etc. And a single group of voluntary muscles is involved here. In all deaths, you will come across rigor mortis, except in cases of burns, where coagulation of albuminous material of the muscles take place due to intense heat. Then muscles affected. As far as cadaveric spasm is concerned, in cadaveric spasm, a group of voluntary muscles are involved. For example, a single group of voluntary muscles are involved. For example, in case of shooting one's own self, muscles of the hand are involved, while rest of the body will undergo rigor mortis in the usual pattern. While rigor mortis, all muscles, voluntary and involuntary, are involved. Now, fifth thing is mechanism. Mechanism of cadaveric spasm is not known, but now they say there is some nervous involvement. While the mechanism of rigor mortis is clearly known that there are two types of myofibrils, actin and myosin, and then ATP is depleted, they fuse together to form a stiff dehydrated gel. Now, medico-legal importance. In cadaveric spasm gives an idea about the last act of life and manner of death, suicidal, homicidal, or accidental. Accidentally, if you fall in water, you will struggle. There may be grass weeds in the hand. You can make an idea. While rigor mortis gives idea about time since death, and change of posture. Now, change of posture. Now, no doubt you know time since death. Now, sometimes while they are shifting the dead body from one place to the other, if one policeman holds the dead body from the hand, another from the legs, the arms are straightened, the legs are straightened, whatever was the actual position, that position is broken. So rigor mortis can be broken with moderate force, while in cases of cadaveric spasm, considerable force is required to break cadaveric spasm. Now, after primary relaxation, we had rigor mortis, and then we have secondary relaxation, which is also known as flaccidity. Now, how will you define it? Stiff gel muscles undergo relaxation with onset of putrefaction. Now, suppose you are examining a body. You are not sure whether the rigor mortis has set in or it has passed off. So the body muscles are relaxed. Now, how will you say this is primary relaxation or secondary relaxation? Because in comparable feature, both relaxation involve muscles. So how will you differentiate between primary relaxation and secondary relaxation? Onset just after death, that is during the period of somatic death. While secondary relaxation, this comes on when the body starts putrefying, that is 36 to 48 hours after death. Secondly, mechanism. In primary flaccidity, muscle tone is lost, while in case of secondary relaxation, along with this you will see putrefactive changes. Then response to stimuli. Now this is the main distinguishing feature. During primary relaxation, because this is during somatic life, somatic death, that is clinical death, the individual cells and tissues are still alive. So if you will give an external stimulus such as a current or a mechanical stimulus such as prick by a needle, the individual muscle fiber, they will flicker. This is primary relaxation. But in secondary relaxation, by that time, which comes after 36 to 48 hours, putrefaction has started. Here, the molecular death has taken place, means individual cells and tissues have already died. So, no response to stimuli, either electrical or mechanical, will be seen in cases of secondary relaxation. So these are few points which you should remember very well. And these are the references from where I have made this lecture.